So good morning to all of you. So I'm Dr. Pradeep Pawar, Professor of Anatomy. Okay, let us start with the first MCQ. Students, good morning to all of you. Let us start. Identify the pointed structure. The one in blue arrow. The one in blue arrow. Identify the pointed structure. The one in blue arrow. Yes, anyone? Whatever you feel, you answer. Whatever you feel, you answer. The pointed structure in blue arrow. That's a cavity I'm asking. The cavity. Anyone? Yes, students, bolo, come on. This cavity I'm asking, this one. The one pointed in blue arrow. This is the cavity. Yes, anyone? No, not corpus callosum. This cavity I'm asking. This is the cavity of lateral ventricle. This is the cavity of lateral ventricle. Very good. That's the cavity of lateral ventricle. And what is that nucleus which you are seeing inside the lateral ventricle? Anyone? What is this nucleus which you are seeing inside the lateral ventricle? Can anyone answer this? This one. The one starred one. This nucleus is going to lie in the floor of the lateral ventricle. There are two nucleus in the floor. This is the thalamus. This is thalamus. This is thalamus. So there are two nucleus lying in the floor of the lateral ventricle. One is the thalamus. And the second one is what? What is this? No, it's not lateral geniculate body. Lateral geniculate body, bacha piche hota hai. It's backside here. It's here behind. On the sides of colliculus. That's a lateral geniculate body. You know, there's a C-shaped nucleus like this. A C-shaped nucleus. Can anyone guess this? A C-shaped nucleus whose tail is known as amygdala. Amygdala. Anyone? A C-shaped nucleus like this. Whose tail is known as amygdala. That's the caudate nucleus. Very good. Yes. Yes, Karnati, you got this. That's a caudate nucleus. So, in the floor of the lateral ventricle, there are two nucleus which lies. One is the caudate nucleus and one is the thalamus. Thalamus. Now, these are very important slides for you students. If this is one thalamus, this thalamus is connected to the opposite thalamus. Correct? We have taken a section here. What is this section? A sagittal section. So this thalamus would be connected to the opposite thalamus by a connection. Can you tell me what is this connection known as? This one, this one. What is this known as, which is cut here? The two thalami, one on both the sides, are connected across the midline by what we call as the interthalamic connections. This is known as interthalamic connections. Remember that. Yes, very good. Interthalamic connections. What is this, students, if you can tell me? What is this? This is a white matter. And this white matter actually comes from below. It comes from the temporal lobe. It comes from the hippocampus. And this white matter comes like this here, like this. And this is what we call as the fornix. This is the fornix. And there's something here which is not drawn. Normally you don't see this caudate nucleus. This is closed by something which lies between the corpus callosum and this fornix. What is that curtain-like thing known as? The septum pellucidum. That would be the septum pellucidum. We have removed the septum pellucidum, and that is how you are able to see the lateral ventricle. You are able to see the caudate nucleus. That would be the septum pellucidum. Clear to all of you? Okay. So what would the septum pellucidum and fornix form for the lateral ventricle? The septum pellucidum and fornix would form the medial wall of the lateral ventricle. The medial wall of lateral ventricle. Relation, medial wall. Perfect, students. What is this now? Corpus callosum. What are the types of fibers? Can anyone answer this? Corpus callosum belongs to what type of fibers? Answer. This is a very important MCQ. Now, white matter of the brain or white fibers of the brain, we classify into three types, correct? One is the commissural fibers, one is the association fibers, and one is the projection fibers. So this corpus callosum belongs to which type of fiber? The commissural fiber, commissural. And this commissural fiber connect opposite hemispheres, similar areas in the opposite hemispheres. That's commissural fibers. One example of commissural fiber is corpus callosum. Any other example of commissural fiber? Because this you very commonly get in the MCQs. One is corpus callosum. Can anyone tell me which are the other commissural fibers? You can answer, students, be interactive. Yes. Which are the other examples of commissural fibers? A corpus callosum मैंने बताया. The other one is anterior commissure. Anterior commissure, the one here. That's the anterior commissure. There's a posterior commissure. There's a habenular commissure. You can see this anterior commissure here. Yes. One is posterior, one is habenular commissure. Very good, very good. What is this area? What is this area? This is the thalamus. And what is this below the thalamus? This is what we call as the hypothalamus. Hypothalamus. And there's a sulcus here. This is the hypothalamic sulcus. Yes, sulcus hoga, hypothalamic sulcus. Perfect. What is this sulcus? Students, can anyone tell me what is this sulcus? A very clearly seen sulcus will be asked as a visual. What is this sulcus? It is going to separate the parietal lobe from the occipital lobe. Any guesses? Parietal lobe from the occipital lobe, and this is what we call as the parieto-occipital sulcus. Parieto-occipital sulcus. There will be a sulcus down here. What would this sulcus be known as? The calcarine sulcus. Calcarine. Okay. So that's the parieto-occipital, and here would be the calcarine sulcus. This lobe is known as what? This lobe is what we call as the cuneus. Cuneus. A calcarine sulcus hoga, it's not very clearly shown here. This is the parieto-occipital. Below here will be the calcarine sulcus. This area is known as the cuneus. Cuneus. Fine. Perfect. Now you tell me, students, what is this sulcus? Can anyone tell me what is this sulcus here? Students, what is this sulcus? Answer this. Corpus callosum ke upar. It's above the corpus callosum, students. What do you call this sulcus above the corpus callosum as? This is a very important MCQ, a very important visual for you. Students, come on, you can crack this. What is this sulcus above the corpus callosum? That's the callosal sulcus. Callosal, ye dekh rahe ho aap? This is the callosal sulcus. And there's someone lying inside the callosal sulcus. Anyone? Someone lying inside the callosal sulcus. Yes, one artery, one vein. Which is the artery, which is the vein? The artery is anterior cerebral artery. This you should know. Huh? This you should know. Artery is anterior cerebral artery. The vein is the anterior cerebral vein. Anterior cerebral vein. So that's the callosal sulcus. In this callosal sulcus lies the anterior cerebral artery and the anterior cerebral vein. Okay, what is this sulcus above the callosal sulcus? Students, what is this sulcus above the callosal sulcus? This is what we call as the cingulate sulcus. Cingulate sulcus. Fine. Fine. What is this cavity here? Students, what is this cavity here? Answer this. This cavity. This is the cerebellum. This is the midbrain. That's a pons, that's a medulla. So what is this cavity going to be? It is between the pons and the medulla and the cerebellum. This is the fourth ventricle. You have fourth ventricle. Fourth ventricle. Clear? Okay, very good, fourth ventricle. This is the lateral ventricle. This is the fourth ventricle. And what is this entire cavity known as? But there's a cavity here, and the thalamus and hypothalamus are lying on the lateral walls. They're forming the lateral walls of this cavity, and this cavity is the third ventricle. You can see this concavity here. Yahan pe concavity dikhta hai. This is the third ventricle. So this is the lateral ventricle. This is the third ventricle. That's the fourth ventricle. The lateral ventricle would be communicating with the third ventricle through a small opening here, that would be known as the foramen of Monro. You can actually see this. This is the foramen of Monro. Here, that arrow is the foramen of Monro. And the third ventricle will be communicating with the fourth ventricle through, what is this channel? That's the aqueduct of Sylvius. Aqueduct of Sylvius. Perfect. Okay, that's it. Come on, we go to the next MCQ. So I've told you everything in this slide, whatever was important. Come on, students. We go to the next MCQ. Answer this. A 30-year-old IT professional developed tingling and numbness in the left hand since 15 days. He gave history of using computers for hours together in this lockdown. On examination, there was atrophy of 3.5. Atrophy of the thenar remnants and loss of sensations over the plantar aspect of 3.5. Palmar aspect होगा, वो palmar aspect of 3.5 fingers. Physician diagnosed it as compression of a structure passing deep to the flexor retinaculum. All the structures pass deep to the flexor retinaculum except. Answer. Can anyone answer this? All the following structures pass deep to the flexor retinaculum except Karnathi. Except. Read the MCQ properly. Read the MCQ, students. I know you know the answer. What is this carpal tunnel syndrome? So you feel it is concerned with median nerve, it will be concerned with the carpal tunnel. But see the MCQ. All the following structures pass deep to the flexor retinaculum except the S. So then what is your answer? A. Yes. So now what do you say? Yes, students, should there be a change? Should there be a change? So one of the following structures pass, because see, ulnar artery goes superficial, correct? Flexor pollicis longus goes superficial to the flexor retinaculum. Flexor carpi radialis does not pass through the carpal tunnel, it passes to the split of the flexor retinaculum. So the answer here should be the median nerve. Should you get an MCQ like this, you should be able to understand that there's something mistake in the MCQ. Understand? So you get the benefit of doubt. You will answer this as median nerve because there is everything goes above the flexor retinaculum except one. So the question should have been one of the following structures pass deep to the flexor retinaculum. Yes, then your answer would be the median nerve. Correct, correct. One of the following passes deep to the flexor retinaculum, then your answer would be the median nerve. One moment, I'll just draw this for you, students. Look at this. Look at this. See, sometimes there might be a mistake in the questions also. You should be able to understand this. Okay, I'll draw this for you, students. Have a look. See, I'm drawing this as the flexor retinaculum. Quickly, we'll finish this topic. Okay, these are the carpal bones. If this is medial and this is lateral, students, what is this going to be? That's the flexor retinaculum. Okay, so these are the carpal bones. This is the flexor retinaculum. The flexor retinaculum on the lateral side splits into two. It divides into two on the lateral side. Okay, now what is the tendon which is passing from this through the split of the flexor retinaculum? Anyone? Come on, answer this. What is this tendon which passes through the split of the flexor retinaculum? This is the tendon of flexor carpi radialis. That's flexor carpi radialis. What are these four tendons of? Students, if you can tell me, what are these four tendons which are passing through the carpal tunnel? These are the tendons of flexor digitorum superficialis and the flexor digitorum profundus. Superficialis and profundus. And what is this tendon of? That's the tendon of flexor pollicis longus. The four tendons of superficialis and the four tendons of profundus, they are put in a synovial sheath. What is this synovial sheath? Known as the ulnar bursa. Ulnar bursa. And this tendon is put in a synovial sheath which is known as the radial bursa. Students, be clear. Huh? Radial bursa with flexor pollicis longus, ulnar bursa with flexor digitorum superficialis and flexor digitorum profundus. Superficialis and profundus. Now tell me, what is this nerve here? That's a median nerve. That's a median nerve. So the median nerve passes below the flexor retinaculum and above the ulnar bursa. It's between the flexor retinaculum and the ulnar bursa. And if there's an ulnar bursitis, there's a compression of medial nerve, and this would be known as the carpal tunnel syndrome. Carpal tunnel syndrome. Very good. Now you tell me, what is this here? What is this ligament known as? This is known as the volar carpal ligament. That's a volar carpal ligament, and between this volar carpal ligament and the carpal tunnel, and the flexor retinaculum, what is this tunnel known as? That's the Guyon's tunnel. Correct? Between the volar carpal ligament and the flexor retinaculum, this is the Guyon's tunnel, and what passes through the Guyon's tunnel is the ulnar nerve and ulnar artery. This is the ulnar nerve and ulnar artery. Students, if you can tell me, what is this tendon of, and what are these tendons of, what are these nerves here, and what is this tendon, and what is this artery? Come on students, if you can tell me this. This is very important. So this, I've drawn the carpal tunnel for you. Students, I've drawn the carpal tunnel. What are the structures which are passing through the carpal tunnel? If there's a mistake in the MCQ, you should be able to identify the mistake and answer accordingly. So this is the carpal tunnel. What are the structures which are passing through the carpal tunnel? This is the tendon of flexor pollicis longus with radial bursa, the tendon of flexor digitorum superficialis and profundus with ulnar bursa, and the medial nerve. So this is one which passes through the carpal tunnel. The tendon of flexor carpi radialis does not pass through the carpal tunnel, students. It passes through the split of the flexor retinaculum. And what are the structures which go above the flexor retinaculum? One is the ulnar nerve and vessels. Ulnar nerve and vessels go through the Guyon's tunnel. What is this tunnel known as? This is the Guyon's tunnel. Okay. Guyon's tunnel. Now, what is this tendon of? This is the tendon of palmaris longus. What is this? Anyone? This is the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. And this is going to supply the skin over the hypothenar eminence. This is the palmar cutaneous branch of medial nerve. And this is going to supply the skin over the thenar eminence. So this is the skin over the hypothenar. This is the skin over the thenar eminence. And this is the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Just remember this, this is extremely important. Structures going above the flexor retinaculum, outside the carpal tunnel, the ulnar nerves and vessels, the palmar cutaneous branch of ulnar nerve. This supplies the skin over the hypothenar eminence, the palmaris longus, the palmar cutaneous branch of medial nerve, and this is going to supply the skin over the thenar eminence, and the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Fine students, fine. Okay, clear to all of you? Okay, we'll come back to this MCQ. Have a look. So this was the MCQ. Now see, you can understand there's a mistake in the MCQ. So one of the following structures, it should have been one of the following structures pass deep to the flexor retinaculum. Then your answer is going to be the medial nerve. I purposely put such type of MCQ so that you should be able to understand it. You should be able to analyze it. Okay, fine, good. Going to the next MCQ, students. Tell me, identify this pointed structure. Another very important MCQ. These are all visuals for you. Students, can you identify this? Pehle bolo, what is this? What are you looking at? As in a visuals, a small window is given. A small window, and you have to really think about it, what you are looking at. Can anyone guess this? Students, I'm waiting. Bolo bacho, even if it is wrong, it's fine. That's no problem. We are discussing things. Fine, no? Anyone, students, what is this? What is this? Is an artery running on either sides of the sternum. That's an artery which runs on either sides of the sternum inside the thorax. Any guesses? Any guesses? Any guesses? Recurrent laryngeal nerve नहीं है बच्चा, ये recurrent laryngeal nerve नहीं है रितेश. No, it's not recurrent laryngeal nerve. This is an artery running on either sides of the sternum. It's in front, it's right behind the sternum, right behind the sternum. An artery which runs on either sides of sternum. This is the internal thoracic artery. बच्चों, this is the internal thoracic artery, also known as internal mammary artery. Internal mammary artery. If I have to search the recurrent laryngeal nerve, Ritesh, if I have to search the recurrent laryngeal nerve, where do I search the recurrent laryngeal nerve? I search it in the tracheoesophageal groove, bacha. Tracheoesophageal groove. There I'll get the recurrent laryngeal nerve. Understanding? So this is the anterior wall of thorax. ये anterior wall है. We are looking from inside the thorax. अंदर से देख रहे हो. Anterior wall from inside. Very good with this. So what is this? This is the internal thoracic artery, a branch of the first part of subclavian artery. A branch of first part of subclavian artery. Exactly. See, that's a subclavian artery. Okay, that's a subclavian artery. What is this artery which is going exactly opposite? Vertebral goes down, one artery goes up. But if that's a subclavian artery, one is the internal thoracic which goes down. Exactly opposite एक artery ऊपर जाती है, and that's the vertebral artery. That would be the vertebral artery. Fine. So this is the internal thoracic, clear? A branch of first part of the subclavian artery. Now this internal thoracic is going to divide into two branches. It divides into two branches. So the internal thoracic artery divides into, can anyone answer this? This is the superior epigastric artery, and this is the musculophrenic. Superior epigastric and musculophrenic. ठीक है? Now this superior epigastric artery will pass through a very important MCQ. Very important MCQ will pass through foramen of Morgagni. Foramen of Morgagni, or the space of Larry. Foramen of Morgagni or the space of Larry, and it will anastomose with inferior epigastric artery. Anastomose with inferior epigastric artery, branch of external iliac. Just remember this is extremely important. So the internal thoracic artery, but it divides into two branches, a superior epigastric and a musculophrenic. The superior epigastric artery enters the abdomen, but from the thorax it has to go into the abdomen. So there's a small gap in the diaphragm in front. There's a small gap, and this is what we call as the foramen of Morgagni. A small gap in the diaphragm anteriorly, that's the foramen of Morgagni, or that is the space of Larry space. And what passes to the foramen of Morgagni is the superior epigastric artery. It anastomoses with the inferior epigastric artery, which is a branch of external iliac. Fine. Students, can you tell me what is this artery here? I mean, what is this muscle here? What is this muscle? Can anyone tell me what is this muscle? Starting from the sternum to the costal cartilages. Students, answer. From the sternum to the costal cartilages. What is this muscle? From the sternum to the costal cartilages. This is the sternocostalis. That's the sternocostalis muscle. And this sternocostalis muscle belongs to a big muscle. Anyone? Can anyone answer this? Sternocostalis. It belongs to a big muscle. That's a transverse thoracicus. Understand this one, students? Transverse thoracicus. We have got three muscles. Sternocostalis. Very good. We have got three muscles. We have got external intercostal muscle. We have got internal intercostal muscle. And the third muscle is known as the transverse thoracicus. This transverse thoracicus is divided into three parts. One is known as the sternocostalis. This is in front. The next one is the innermost intercostal, and the third one is the subcostalis. Sternocostalis, innermost intercostal, and the subcostalis. But for all practical purposes, students, for all practical purposes, we take the three muscles as external intercostal, internal intercostal, and innermost intercostal. We normally call this as innermost intercostal, but yaad rakhna, this innermost intercostal actually belongs to a big muscle which is known as the transverse thoracicus. Transverse thoracicus, whose other parts are sternocostalis and the subcostalis. Sternocostalis and the subcostalis. Okay, so these are the parts of transverse thoracicus. Okay, students, now we proceed to the next slide. Okay, just answer this. Identify this pointed structure. Identify this pointed structure. Identify this pointed structure. Yes, students, come on. You can crack this MCQ. Identify this pointed structure. A very important visual for you. A very important visual for you. A very important visual. Come on, students, come on. The time is running. You should be able to understand and answer this. The moment you see this slide, you should be able to answer this. Boliye. Are you able to? Flexor digitorum profundus. Very good. That's a flexor digitorum profundus. Students, are you able to follow this? That's the tendon of flexor digitorum profundus. Yes, a visuals here, students. You should be knowing this. Ye dekho. I'm just drawing this phalanges for you. These are the three phalanges of the fingers I'm drawing. Now there's a tendon which comes here. There's a tendon which comes like this. At the base of the proximal phalanx, this tendon divides into two. And this is inserted into the middle phalanx. Ye jo tendon hai, it is inserted into the base of middle phalanx. What is this tendon of? This is the tendon of flexor digitorum superficialis. Flexor digitorum superficialis. There are four tendons of superficialis, and this four tendons of superficialis comes at the base of the proximal phalanx, divides into two, inserted on the base of middle phalanx, and this one tendon which is passing through this tendon, and which is getting inserted on the base of the distal phalanx. What is this tendon of? This is the tendon of flexor digitorum profundus. Flexor digitorum profundus. So where is the insertion of profundus? On the base of the distal phalanx. Insertion of profundus is on the base of the distal phalanx, and insertion of superficialis is on the base of the middle phalanx. Base of the middle phalanx. Clear, students? So who's going to flex the distal interphalangeal joints? Who's going to flex the distal interphalangeal joints? That's the tendon of flexor digitorum profundus. बहुत MCQs आते हैं on this concept. Like a student is playing football, meets with an accident, and the student is now not able to flex the distal interphalangeal joint of the fingers. Distal interphalangeal joints of the fingers, which is the tendon injured. But the rest of the interphalangeal joints are clear. Distal interphalangeal joints is not able to flex. So this is the injury to the flexor digitorum profundus. Okay, the rest of them are intact. Is this clear? Students, can you tell me the nerve supply of flexor digitorum superficialis? Nerve supply of flexor digitorum superficialis बोल सकते हो कोई? Yes. Can anyone tell me the nerve supply of superficialis? Flexor digitorum superficialis. That's the medial nerve. And flexor digitorum profundus के दो nerve supply है. Flexor digitorum profundus lateral half. Yes, lateral half and medial half. Come on. Lateral half and medial half. Lateral half would be supplied by whom? Anyone? Answer this. Lateral half of... Yes, Shreyas Kulkarni. Follow. Lateral half would be supplied by whom? Lateral half and medial half. No, I want a specific answer. Medial half, I give it as ulnar. That's fine. Medial half, ulnar is correct. Yes. And the lateral half? Instead of saying medial nerve, would you prefer anything else? A still better answer than medial nerve? A still better answer than medial nerve? It's a branch of median, bacha. It's a branch of median. And that is the anterior interosseous nerve. That would be a very specific answer. Anterior interosseous nerve. So anterior interosseous nerve is a deep branch of median nerve. Perfect, perfect. Okay, good. Good. Students, come on. Answer this MCQ now. What do you think is this? What do you think is this MCQ? This pointed structure? Yes. Shreyas, correct. Ye bolo ab. That's the soft palate. Very nice. That's the soft palate. Yes. And all the muscles of the soft palate are supplied by whom? Students, can you answer this MCQ? All the muscles of the soft palate are supplied by pharyngeal plexus. All the muscles of the soft palate are supplied by pharyngeal plexus except epiglottis nahi hai bacha. This is not epiglottis, that's soft palate. Acha, this is soft palate, this is not epiglottis. Epiglottis is down here. I'll show you the epiglottis. All the muscles of soft palate are supplied by pharyngeal plexus except one muscle is not supplied by the pharyngeal plexus. कौन है ये? Palatoglossus नहीं, not palatoglossus, not palatoglossus. Guess. Pharyngeal plexus is vagoaccessory complex, bacha. Pharyngeal plexus is vagoaccessory complex. So all the muscles of the soft palate are supplied by pharyngeal plexus or the vagoaccessory complex except एक muscle है in the soft palate. Answer that. Any guesses? Okay. I just enumerate the muscles of the soft palate. Genioglossus is a muscle of the tongue, Marvel. Genioglossus is a muscle of the tongue. It's not a muscle of the soft palate. Which are the muscles of the soft palate? Okay, let me enumerate the muscles of soft palate. One is the tensor palati. One is tensor tympani. Tensor palati, tensor tympani. One is palatoglossus. One is palatopharyngeus. And which is the last one? Musculus uli. Abhi bolo. Now I've told you the muscles. Yes, you got this right. That's the tensor palati. So tensor palati, levator, tensor tympani nahi hoga. I'm so sorry. एक minute. One moment. One would be the levator palati. No, not tensor tympani. It's levator palati. This would be the levator, not tensor tympani. It's a levator palati. Tensor tympani was in the ear, no? So, tensor palati, levator palati, palatoglossus, palatopharyngeus and musculus uli. Out of this, all the muscles are supplied by pharyngeal plexus except the tensor palati, and this tensor palati is supplied by mandibular nerve. Mandibular nerve because this mandibular nerve is derived from the first pharyngeal arch. It is derived from the first pharyngeal arch. This is therefore supplied by the tensor palati is derived from the first pharyngeal arch. It is supplied by mandibular nerve. Perfect. Okay, very good. Identify this structure. Students, just tell me what is this structure. Tensor tympani is in the ear. Tensor tympani tenses the tympanic membrane. It is also supplied by the mandibular nerve. It is also derived from the first arch. Okay, fine. Identify this now. What is this? Epiglottis. Very good. That's the epiglottis. Students, can anyone tell me the nerve supply of epiglottis? Another very important MCQ. Nerve supply of epiglottis. Anyone? Epiglottis का nerve supply बोल सकते हैं? Nerve supply of epiglottis. Epiglottis is derived from fourth pharyngeal arch. I'm telling you, epiglottis is derived from the fourth pharyngeal arch. Abhi bolo uska nerve supply, you tell me. Internal laryngeal nerve. Which is the nerve of the fourth arch? Nerve of the fourth arch is superior laryngeal nerve. Superior laryngeal divides into an external laryngeal nerve and internal laryngeal nerve. This internal laryngeal nerve supplies the sensory supply of the larynx above the vocal folds. It also supplies the posterior most part of the tongue and epiglottis. Okay, because it is derived from the fourth arch. It supplies the sensory supply above the vocal folds. It also supplies the posterior most part of the tongue and epiglottis. What is the external laryngeal nerve supply? cricothyroid. It supplies the cricothyroid. Okay, students, identify this now. Come on. Identify this. What am I pointing here? What am I pointing here? What is this? What is this? Any guesses? Any guesses? Any guesses? What is this? Answer. Students, what is this? Any guesses? So here, falx cerebri. Very good, falx cerebri. Perfect. There's a sinus here. On the superior border of the falx cerebri, there's a sinus here. And there's a sinus here on the inferior border of the falx cerebri. Here, like this. Can anyone tell me what is this sinus? What is this sinus on the superior border of the falx cerebri? That's the superior sagittal sinus. Right? And what is this sinus? That's the inferior sagittal sinus. Now this inferior sagittal sinus continues as what? Ye kya sinus hoga? What would this sinus be? This is the straight sinus. This is going to be the straight sinus. So inferior sagittal sinus continues as the straight sinus. Perfect. Perfect, students. Okay. What is this? The main bulk of the tongue formed by? What is this muscle forming the main bulk of the tongue? Anyone? The main bulk of the tongue is formed by genioglossus. The main bulk of the tongue is formed by the genioglossus. Okay. And what is the action of genioglossus? It protrudes the tongue. It protrudes the tongue. It prevents the tongue from falling back. It protrudes the tongue. But remember, students, the genioglossus protrudes the tongue to the opposite side. But if the right genioglossus will protrude the tongue to the left and the left will protrude the tongue to the right. Clear? So that's a region of right hypoglossal nerve. Suppose if the right hypoglossal nerve is injured, the right genioglossus is paralyzed, the left becomes powerful and the left will deviate the tongue to right side. The left will deviate the tongue to right side. So in lesions of hypoglossal nerve, yes, safety muscle, yes. In lesions of hypoglossal nerve, the tongue is deviated to the same side of lesion. In lesions of hypoglossal nerve, the tongue is deviated to the same side of lesion. Okay, answer this MCQ. A 60-year-old male was diagnosed as carcinoma of the testis and orchidectomy was planned. The surgery resident was recollecting the lymphatic drainage of testis. Testis drains into which of the following lymph nodes? A very important MCQ. Testis and ovary drains into which lymph nodes? Anyone? Testis and ovary drains into which lymph nodes? Students. Para-aortic lymph nodes. Very good. The para-aortic lymph node. Testis and ovary drains into the para-aortic lymph nodes. Right. And tell me, the testis and the ovary develops from what? Where does this develop from? Yes, this is very important to students. If you can tell me, testis and the ovary develops from what? Anyone? 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 Testis and the ovary develops from? बोल सकते हो? Come on, come on, come on, students, quick, quick. Testis and the ovary develops in the intermediate plate mesoderm. Intermediate plate mesoderm. Intermediate plate mesoderm. You've got paraxial, you've got intermediate plate, you've got lateral plate mesoderm. So this intermediate plate mesoderm has four things. इसमें चार चीजें होती है. One is the nephrogenic ridge. Nephrogenic ridge. Second is gonadal ridge. Nephrogenic ridge, gonadal ridge. One is the mesonephric duct and the second one is the paramesonephric duct. Okay, mesonephric duct and the paramesonephric duct. So nephrogenic ridge, gonadal ridge, mesonephric duct and the paramesonephric duct. Students, remember, these are the four things which are formed in the intermediate plate mesoderm, and this is, the name itself suggests what? It is mesoderm. That means all this is going to be what in origin? Mesodermal in origin. This is all going to be mesodermal in origin. अब ये nephrogenic ridge, you must be knowing, divides into a pronephros, mesonephros, metanephros. So this will give rise to the kidneys. Okay, this will give rise to the kidneys. Correct? The gonadal ridge will give rise to the gonads, the testis and the ovaries. Gonads. They will give rise to the gonads, testis, ovary. The mesonephric duct forms the genital system of males. I just enumerate this. What does the mesonephric duct form in males? It forms one, the epididymis, the vas deferens, the seminal vesicles, the ejaculatory duct, and the prostate. You have to know all this. This all things are very important. They are asked in the MCQs. So what does the mesonephric duct form in males? The vas deferens, the epididymis, the vas deferens, the seminal vesicles, the ejaculatory duct, and the prostate. And what happens to the mesonephric duct in females? The mesonephric duct degenerates in females. It degenerates in females. What is the remnant of mesonephric duct in females? Anyone? What is the remnant of mesonephric duct in females? Can anyone answer this? What is the remnant of mesonephric duct in females? It degenerates off. What does it form? No, not epiphron. No. Not epiphron, paraphron. No. Yes. No, I teach for Unacademy. Bacha. What was I telling? What is the mesonephric duct form in females? It degenerates off in females. Yes, it forms the Gartner's duct. Remember, this is a very important MCQ, bacha. Gartner's duct. A very important MCQ. So, what is the remnant of mesonephric duct in females? Gartner's duct. And in males, it forms the entire genital system of males except testis. Testis छोड़ के जो भी rest है, that is formed by the mesonephric duct in females, because testis कहाँ से derive होता है? Testis is derived from gonadal ridge. What is a paramesonephric duct form? बच्चों, paramesonephric duct forms the entire genital system of females. So बच्चों, what is a paramesonephric duct form? It forms the fundus, body, cervix of the uterus. It forms the fallopian tubes, and it forms the upper 1/3 of the vagina. Upper 1/3 of the vagina. No controversies on this. It's upper 1/3. Okay. So it forms the fundus, it forms the body, it forms the cervix, it forms the fallopian tubes, and it forms the upper 1/3 of the vagina. Upper 1/3 of the vagina. Okay. Tell me, what happens to it in males? What is the paramesonephric duct form in males? Can anyone tell me? The paramesonephric duct degenerates off in males, correct? Because it is functional in females, it degenerates off in males. Males में एक hormone होता है, anti-Mullerian hormone. So this causes regression of the paramesonephric ducts, bacha. So tell me, what is the paramesonephric duct form in males? It degenerates off, but yes, it forms two vestigial structures in males. Anyone? Can anyone answer this? This is very important. Remnant of paramesonephric duct in males. One is the appendix of testis. Very good. And second, there's a small structure inside the prostate. The prostatic utricle. So the remnant of paramesonephric duct in males, appendix of testis, and the prostatic utricle. Am I clear to all of you? Is this clear? Right. Upper 1/3 of the vagina is derived from paramesonephric duct. Can anyone tell me the lower 2/3 of the vagina is derived from what? Lower 2/3 of the vagina is derived from sinovaginal bulbs, which are derived from the urogenital sinus. Remember, students, sinovaginal bulbs, which are derived from the urogenital sinus. Now, this urogenital sinus is endodermal in origin. So the lower 2/3 of the vagina would be endodermal in origin, and the upper 1/3 is derived from the paramesonephric duct. So that is going to be mesodermal in origin. Perfect. Be very clear about this. And you are asking me this now, epiphron and paraphron. Yeah, no, there's something known as mesonephric tubules. Mesonephric tubules. ये जो pronephros होता है, mesonephros होता है, metanephros होता है ना, pronephros disappears off. Mesonephros forms what? Small tubules, which are known as mesonephric tubules. And this mesonephric tubules, what do they form in males and what do they form in females? In males they form paradiaptomis, and in females they form the epophuron and paraophuron. Epophuron and paraophuron. This is derived from mesonephric tubules. Remember students, mesonephric tubules forms the epophuron and paraophuron. I hope this is clear to all of you. Perfect. So just remember this. Plenty of MCQs on this topic that you get. Okay students, identify this now. Another very important visual for you. Very important visual. Can anyone guess this? A very important visual. Can anyone guess this? पहले देखो, पहले understand it. First see which compartment it is. हाँ, पहले compartment देख लेना and then you answer. Shall I give you 2 minutes? Think and answer. Anu. Okay, I'll call you Anu. Anu, which compartment is this, bacha? Which compartment is this? This is not anterior compartment, no. And see, one thing, you have to be very clear about the muscles of the leg. Muscles of the leg should be perfect. Kaun se compartment mein which muscle is there? That has to be perfect. You are saying this is tibialis anterior? No. Tibialis anterior is this, bacha. Tibialis anterior is this. This is tibialis anterior. Okay. So this is tibialis posterior. Very good. This is tibialis posterior. It's a muscle of the posterior compartment of the leg. It winds around the medial malleolus. It comes and gets inserted into the navicular tuberosity. Navicular tuberosity. This is the tendon of tibialis posterior. Tibialis posterior. What is this tendon of? This is the tendon of flexor digitorum longus. This is flexor hallucis longus. Flexor digitorum longus, flexor hallucis longus. This is the extensor hallucis longus. Extensor hallucis longus. What is this ligament? Deltoid. That's the deltoid ligament. And what is this? This is the tendoachilles. That's the tendoachilles. Tendoachilles or the tendocalcaneus. Tell me students, the tendon which winds around the medial malleolus is what? Look at the slide and tell me. The tendon which hooks around, which winds around the medial malleolus is the tendon of... Yes, the tendon which winds around the medial malleolus is the tendon of tibialis posterior. That's the tendon of tibialis posterior. Perfect. So these are some very important slides. Remember this. If you can answer this, students. Epiphysis is of multiple types. Which of the following is an example of epiphysis which takes part in joint formation and is not involved in muscle pull? Which takes part in joint formation? Answer the students. Anyone? Answer is tibial condyles. Tibial condyles, yes. Answer is the tibial condyles. So what is that type of epiphysis which takes part in the formation of joints? This is the pressure epiphysis. Pressure epiphysis. Pressure epiphysis, coracoid process nahi, not coracoid process. Pressure epiphysis is the one which is formed, pressure epiphysis is seen at ends of long bones which are subjected to pressure. So that type of epiphysis is known as pressure epiphysis. Examples are the head of the femur, the condyles of tibia, the condyles of femur. So that's pressure epiphysis. Epiphysis which is formed due to pull of the muscles are known as what? Traction epiphysis. Traction. So epiphysis formed due to pull of the muscles is known as traction epiphysis. Example is trochanters, tubercles, mastoid process. These are traction epiphysis. The third epiphysis is functional in lower animals, degenerated in humans. Example is coracoid process of scapula, and this is what we call as the atavistic epiphysis. Atavistic epiphysis. It is functional in lower animals and it is degenerated in humans. And the last type of epiphysis is known as aberrant epiphysis. What is aberrant epiphysis? It's an extra epiphysis, an additional epiphysis, extra. Okay, example is the first metacarpal bone. The proximal end of the first metacarpal bone is an example of aberrant epiphysis. Are you able to follow the students? Proximal end of the first metacarpal bone. So just remember the types of epiphysis. This is also very important. Pressure, traction, atavistic and aberrant. The examples are very important. Examples are very important. Clear to all of you? Okay, we'll go to the next MCQ. Understand this structure. Tell me, what is this arrow pointing to? Can anyone tell me this? Arrow pointing to what? Come on, students, come on. Any guesses? You can guess. Come on, students, you can guess. There's no problem even if it is wrong. What is this epiphysis? What is this arrow pointing to? Entry of internal laryngeal nerve. Very good. That's the entry of internal laryngeal nerve. And what is the structure that the internal laryngeal nerve is piercing? What is the structure which the internal laryngeal nerve is piercing? The thyrohyoid membrane. Very nice. That's the thyrohyoid membrane. And what is this fossa here? What is this fossa, bacho? What is this fossa? What do you call this fossa as? Between the thyrohyoid membrane and the artery-epiglottic folds. What is that membrane? What is that fossa known as? Anyone? Between the thyrohyoid membrane and the artery-epiglottic folds, that fossa is known as the pyriform fossa. Pyriform fossa. Okay, that fossa is known as the pyriform fossa. So nerve supply of the pyriform fossa becomes the internal laryngeal nerve. Internal laryngeal nerve. That's the epiglottis again. That's the epiglottis. These are the artery-epiglottic folds, the corniculate and the cuneiform cartilages. Smuggler's pouch. Very good. Who's a tensor of vocal cords, students? Can anyone answer this? Tensor of vocal cords. Can anyone answer this? Who's a tensor of vocal cords? Tensor of vocal cords is cricothyroid. Cricothyroid. Tensor. Answer this MCQ. Answer this visual, students. Yes, very good. Very good. Very good. Identify this pointed structure. Anyone? Anyone? What is this area? नहीं समझ में आ रहा है. What is this area? What have we cut here? ये ना ये ऐसे. We've cut something here. What was this that we have cut? Anyone? Can anyone tell me what have we cut here? That's नहीं. What have we cut here? This is the ramus of the mandible. We've cut the ramus of the mandible. We have removed the ramus of the mandible. ये जो area आप देख रहे हो, this area that you're looking at is the infratemporal fossa. That's the infratemporal fossa. Infratemporal fossa. What is this nerve here? This nerve is going to be the lingual nerve. Lingual. Remember, that's the lingual. Yes. And what is this nerve that you're seeing? This nerve is the inferior alveolar nerve. Lingual nerve and the inferior alveolar nerve. Okay. Lingual nerve and inferior alveolar nerve. What is this artery? Can anyone tell me what is this artery here? ठीक है, remember students, in the infratemporal fossa you always get two nerves, दो nerves होंगे. The one in front is going to be lingual nerve, the one behind the lingual nerve is going to be the inferior alveolar nerve. Lingual nerve and inferior alveolar nerve. Okay, what is this artery going to be? This artery here is going to be, can anyone answer this? This artery here is the maxillary artery. Very good, very good, very good, Shreyas. Second part of maxillary artery, very nice. Second part of maxillary artery. Okay, can anyone tell me what is this muscle? ये muscle क्या है? What is this muscle? Yes, what is this muscle? Any guesses? Any guesses? This muscle is a masseter. Sorry, that's a buccinator. I'm so sorry. That's a buccinator muscle. Buccinator. And what is the nerve supply of buccinator? That's a buccal branch of facial nerve. Buccal branch of facial nerve. That's buccinator. What is this artery going to be? That's the facial artery. And the facial artery is a branch of external carotid. That's the facial artery, which is going to be a branch of external carotid artery. What is this nerve which is coming out of a foramen here? ये foramen देख रहे हो? This foramen is the infraorbital foramen. Infraorbital foramen, and the nerve which emerges out from here is the infraorbital nerve. The nerve which emerges out of the infraorbital foramen is infraorbital nerve. What is this muscle here? This muscle is the temporalis. These are very important MCQ students. Very important. ये है temporalis. Temporalis. Can anyone tell me what is this artery here? What is this artery here? What is this artery and what is this nerve here? Artery and nerve. Students, answer. The artery is superficial temporal artery. The artery is superficial temporal artery and the nerve is the auriculotemporal nerve. Superficial temporal artery and the auriculotemporal nerve. Clear? Okay. What is this gland here? This is the submandibular gland. Submandibular gland. And what is the cranial nerve supplying the submandibular gland? Posterior auricular नहीं है, वो auriculotemporal nerve है. That's the auriculotemporal nerve. What is this gland? Submandibular gland. And what is the nerve supplying the submandibular gland? The facial nerve. The facial nerve supplies the submandibular gland. This is the anterior belly of digastric. Anterior belly of digastric. Can anyone tell me the nerve supply of anterior belly of digastric? Come on, students.